How to deal with epilepsy. Epilepsy is a medical condition that originates in the brain and causes recurring seizures. Symptoms of seizures may vary, but even mild episodes can be considered quite dangerous if they occur while the person is driving, swimming or performing other activities. While there is no known cure for epilepsy at this time, patients who are diagnosed with this disorder can learn how to deal with epilepsy to lower the likelihood of seizures. By understanding treatment options, managing symptoms at home and getting support, many epilepsy patients enjoy more symptom-free days and a higher quality of life overall. Know how to recognize the symptoms of a seizure. Signs of a seizure can vary from patient to patient and episode to episode. The most common types of seizures include uncontrollable convulsions and loss of consciousness. Some of the less-known symptoms of epilepsy seizures might be jerking movements in the arms and legs, lip smacking or blank staring. By identifying the symptoms of a seizure, you are better equipped to provide epilepsy treatment when necessary. Train people in your household on how to manage a seizure. The primary focus of epilepsy treatment during a seizure is to make sure the person doesn't injure himself during the episode. By cushioning the head, loosening tight clothing around the neck, and turning the person on his side, you lower the chances of injury. Do not try to restrain a person or place anything in the mouth in the midst of a seizure. Observe how long the episode lasts and the specific symptoms of the seizure to report to the doctor later. Talk to your doctor about ways to cope with epilepsy. Most patients with this disorder will first try medication to lower the incidence of seizures. Pinpointing the best anti-seizure medication for a specific patient can be a process of trial and error until the best combination is found. However, many patients who find medication to be an effective epilepsy treatment actually go off their medicine after a number of years with no further symptoms of their condition. Work with your doctors to pin down your triggers too. You may find that your epilepsy is mainly triggered by lack of sleep or by flashing lights. Finding this out can massively help you know what to expect and when. Change your diet. Some patients with epilepsy find that a special diet program, known as a ketogenic diet, helps reduce the incidence of seizures. A ketogenic diet is high in fat and low in carbohydrates, which forces the body to break down fat instead of carbohydrates for energy. Ketogenic diets should only be performed under a doctor's supervision to ensure the dieter gets sufficient nutrition and does not experience any unpleasant side effects from the program. Talk to your doctor about surgical options if none of the above steps are effective in treating your condition. There are a variety of surgical procedures that can lower the incidence of seizures in some patients. However, each procedure comes with its own risk factors, so it is important to carefully weigh surgical solutions with your doctor before committing to a procedure. Remain positive as you get used to your diagnosis. Suffering with epilepsy does brings many struggles and hardships, but stay strong and be positive in the hard times. Emotions play an important part in dealing with any hardships in life, including epilepsy. Build your confidence. Visualize yourself doing things you would be doing as the best version of yourself, with or without epilepsy. Use this visualization to help you succeed every day. Take action. As they say, inaction is the greatest failure of all. Now that you have that confident image, and know the positive empowering emotions to help make the best version of yourself, you can focus on making changes in life to best cope with epilepsy.